Hi everyone. In this video we will discuss gastro-retentive drug delivery system. These tablets float or swell to stay in the stomach longer. This allows controlled drug release for medicines absorbed best in the upper GI tract. So, dissolution method must capture buoyancy, hydrodynamics, and long duration release behavior. Only then we can predict real in vivo performance. Staying buoyant prevents tablets from moving too quickly into the intestine. GRDDS are designed to remain in the stomach for 8 to 24 hours. They work by floating, low density system, swelling or expanding, and sometimes bioaddition. Common excipients include HPMC, carbomers, and gas-forming agents like sodium bicarbonate and citric acid. This enables slow targeted release in gastric environment. GRDDS are especially useful for drugs with a narrow absorption window in the upper GI tract. With USP apparatus 2, most agitation occurs near the bottom of the vessel, but floating GRDDS tablets stay at the surface, away from effective mixing, so they experience weak agitation, causing high variability. Release is often highly pH dependent, limited to stomach conditions, gas formation, changes hydrodynamics, and tablet swelling thickness and boundary layer. And since release can last up to 24 hours, method selection becomes critical for meaningful results. Hydrophobic matrix tablet release drug by diffusion and erosion. When they float, the system becomes more complex. Floating happens by CO2 entrapment or low density polymers. Swelling and hydration form a gel layer that controls diffusion. Erosion occurs as the polymer slowly dissolves. Most systems use a combination of these mechanisms to control drug release. USP apparatus 2 is preferred in QC for simplicity and standardization. But floating tablets need modifications by helix sinker or Bayer cages to maintain consistent hydrodynamics. USP apparatus 1, the basket prevents floating but can restrict tablet swelling. USP apparatus 3 is useful for pH changes studies. USP apparatus 4, flow through cell, provides linear flow and is highly biorelevant for swelling systems and long-term release. So, apparatus selection must match GRDDS mechanism. Floating is desired in vivo but problematic in vitro. To ensure proper agitation exposure, we use sinkers, preferably helix Bayer type. But sinkers must not interfere with swelling or gel formation. For floating tablets, use appropriate sinkers, adjust paddle depth, and minimize air bubbles. This is critical for swelling tablets. Ensure enough space in the basket and avoid crushing or restricting expansion. Proper setup ensures reliable dissolution data. Effervescence system generates CO2, which can change pH and hydrodynamics inside the vessel. For gastro-retentive system, use acidic medium, typically pH 1.2. Avoid buffer transitions unless the formulation especially requires pH change testing. Sodium bicarbonate can raise local pH, so this effect must be monitored. For long studies, confirm media stability throughout the test and avoid surfactants unless scientifically justified. Floating GR tablets usually stay just below the liquid surface, so RPM selection is critical, typically 50 to 75 RPM. Too low and mixing around the tablet is poor. Too high and the gel layer may erode too quickly. The goal is stable, consistent hydrodynamic. exposure for reliable release data. In GR matrix tablets, the first 1-2 hours often show minimal release. That's because gel layer is forming and hydration is still stabilizing. So late phase performance is what really matters. It reflects polymer strength and system stability. Test runs long, 8 to 24 hours. A typical sampling plan is 1, 2, 4, 6, 8, 12, 16, 20, and 24 hours. This captures early swelling and late erosion phases. Avoid too many early time points. Little release is expected then. Visual monitoring is essential during GR dissolution testing. If tablets float at the surface, agitation is poor and results become inconsistent. Sticking to basal walls changes swelling behavior. Gas bubbles trapped on the tablet create false buoyancy. So always use degassed media. Avoid overly tight sinkers. They can distort swelling. And watch for pH drift because it alters polymer performance. Good visual means good data. GRDDS need tighter hydrodynamic control than standard extended release tablets. For regulatory acceptance, method must be scientifically justified and validated for long duration testing. First, understand the floating and swelling mechanism. Choose an apparatus that ensures reproducible hydrodynamics. Control buoyancy using sinkers only when appropriate. Select media that reflect stomach physiology. Use extended time points up to 24 hours. And finally, maintain discriminatory power and validate method robustness. That's the key to reliable GRDDS dissolution testing. For ANDA and 505(b)(2) submissions, discriminatory power is critical. FDA expects methods that are sensitive but not overstressed. Your test must detect changes in polymer grade and viscosity, polymer quantity, gas forming agents level, and compression force. Avoid overly aggressive conditions. They can mask real formulation failure. A good method reveals differences, not hides them. Thanks for watching. In next video, we will discuss high dose drug versus low solubility drugs, dissolution strategy difference. Please subscribe us for getting update on upcoming industry application oriented video and stay tuned because in this 62 video series, we will discuss dissolution method development, validation, troubleshooting and many more real industry examples. Please share your queries in comment section. See you in next video. Thanks.